Hi, Professor. This is the scan of my room. This is my patient. Um, this is where I am. I'm going to go ahead and set you up here. Okay. Hi, I'm your nurse Charlotte, and I'll be doing your head-to-toe assessment today. Can I get your name and your birth date?
Jennifer Gibson, 11/7/1990.
Okay, I'll be performing hand hygiene. Okay, can I take a look and see your wrist? Checking the wristband. Patient's identity is confirmed. So Jennifer, do you have any pain right
No.
now? Do you have any allergies to food or medication?
No.
Okay, and I'm going to ask you a few questions. Do you know where you are?
Yes.
Where are you?
Elisa Viejo.
Okay, and do you know who the president is?
Donald Trump.
Do you know what day it is?
It's Friday.
So my patient is alert and oriented times 3. So Jennifer, your general mood, what is your general mood?
Happy?
And do you normally wake up happy?
Yes.
Okay, good. Thank you. So I'm going to go ahead and move on and check my patient's vitals. Okay. So I'll be checking my patient's blood pressure on her left arm, and it is 128/80 mmHg. I'll be checking her radial pulse on her left side, and it's 68 beats per minute. Respirations is 16 breaths per minute. Temperature is 98.6 Fahrenheit oral. SPO is 99% in room air. Okay, Jennifer, do you wear any corrective lenses?
No.
No. So I'll be taking the Snellen chart. So for the Snellen chart, I will be standing 20 feet from my patient, and I'm going to instruct my patient. Can you cover your right eye? And then cover your left eye. So as my patient alternates, I'm going to be checking her vision one eye at a time. And my patient was able to see at 20/25. So when my patient was able to see at 20 feet, a person with normal vision can see at 25 feet. Okay, thank you. So Jennifer, I'm going to ask you to stand up and have both feet together, hands to the side, and close your eyes. So now I'll be assessing my patient for 20 seconds, and I'll be observing my patient. Mild swaying is noted, and that is a normal finding. Okay, go ahead and open your eyes. I'm going to ask you to take steps forward, one leg in front of the other, and I'll be assessing my patient's gait. Thank you. Go ahead and have a seat. So now I'll be doing, sorry, Professor, the whisper test. I'm going to ask my patient to cover one ear, and I'll be in her opposite side, and I'll be standing 2 feet away. Go ahead and cover your right ear, and repeat to me what I said.
I love nurses.
Okay, cover your other ear.
I love bananas.
Okay. Thank you. All right. So now I'm going to go ahead and inspect my patient's head. So I'm going to be checking her head, checking for any signs of discoloration, making sure that skin is intact, no lesions. Good. So now I'm here, I'm going to go ahead and palpate her lymph nodes. So right behind, I have her occipital. Behind her ears, I have her post-auricular. And I have pre-auricular. I have tonsillar. I have submandibular, submental, and supraclavicular. And lymph nodes are non-palpable. Good. Okay, so now I'm going to be assessing my patient's carotid artery, one at a time. Okay. So now I'm going to disinfect my pen light. So I'm going to go ahead and look inside your ears. So patient's ears are, the skin is intact, and when I look inside, no signs of obstruction, minimal cerumen. And then the opposite side is similar finding, minimal cerumen, skin is intact, and no obstruction. Do you use any hearing devices?
No.
No? Okay, good. So now I'll be checking my patient's Perla, her cranial nerves 3, 4, and 6. So I'm going to ask you to just look straight ahead. I'm going to shine a light in your eyes, and I'm going to be checking for pupil constriction. So her pupil constriction is brisk, and then I'm checking for consensual constriction. Good. So now I'm going to ask you to follow my pen light. I'll be 12 to 18 inches away from my patient. So go ahead and just follow my pen light, and this is the 6 cardinal gaze, and I'll be observing for any signs of nystagmus. So no nystagmus noted. I'm going to check for accommodation. Good. Thank you. Okay, so now I'm going to ask you to tilt your head back, and I'll be looking inside your nose. No signs of polyps, no abnormal discharge, and no signs of deviated septum. If you can open your mouth for me, say ah.
Ah.
Checking her tonsils. Tonsils are grade 2. All teeth are intact. Oral mucosa is pink and moist. Can you lift your tongue? And frontal limit's midline. Can you smile for me? Can you puff up your cheeks? Can you stick your tongue out and side to side? Good. Thank you. So now I'm going to ask you to tilt your head 45 degrees, and I'll be shining a light. Checking for any signs of JVD. No signs of JVD. Thank you. Okay. I'll be performing hand hygiene. Can you shrug your shoulders for me? Good. And down. Okay. So now I'm going to ask you to close your eyes. I'll be doing the checking your sense of smell. Cover one nostril, please. And tell me what you smell.
Coffee.
Okay. And then cover the other nostril.
Cinnamon.
Cinnamon. Good. All right. So now I'll be inspecting my patient's skin on her arms. Checking for signs of discoloration, making sure her skin is intact. I'll be lightly palpating, checking temperature. Patient is warm to the touch. I'll be palpating her brachial, bilateral, and her radial, bilateral. I'm going to check her capillary refill, and they're brisk, less than 3 seconds, and then the other, brisk and less than 3 seconds. Can you go ahead and squeeze my hands? Checking for muscle strain. So now I'm going to ask you to put your arms to the side and forward. Checking for her range of motion. Good. So now I'll be inspecting my patient's chest area, making sure that her chest is symmetric, and inspecting the skin. I'm going to go ahead and listen to your heart, okay? I'll be disinfecting my, my tool, my stethoscope. Okay. So on her right side, on the second intercostal, is her aortic. And I'll be listening to this, checking to see if, making sure that S2